Okay. You can see?
Okay. ¿Cómo es eso? Porque tú ibas a estar aquí en el cuarto, ¿no? ¿Y cómo te sientes?
I don't know, today feels weird. I keep looking at the time expecting it to be like...
I would only imagine how hard it is not to be able to kiss the child, to hug the child. It's probably devastating. But this is something that is done to make sure that everybody stays as healthy as possible.
Yo lo siento, es difícil, ¿no?
Oh, I'll have cream and sugar. Or you can bring it up.
So normally there would be a lot of patients, people walking around, pushing their babies, carrying their babies.
This is the area where families and grandparents, there'll be a lot of cheering, there'll be a lot of food sharing. My office is right here. I can hear everything. I know when the baby is born because I hear, wow! It's deserted now. You see nobody.
Usually the grandparents would come in and see the baby afterward.
Yeah.
And there's, none of that. There's no extended family coming to see. Mom goes to postpartum by herself, and the labor support person leaves and goes home.
For me personally, thinking about after the delivery, I won't be here postpartum. So
yeah, that'll be different.
That'll be different. Me walking out of the hospital, knowing that my wife is going to have to kind of be alone for the first 24 hours is definitely a source of anxiety for myself.
I can't even imagine. Being a first-time mom with everything going on, I would be I'm a nervous wreck now, but I'd be even more nervous for sure.
¿Tienen otros niños o es su primer niño?
Primero.
Primero, felicidades, qué bueno.
Gracias.
Slow. Okay, stop.
So we're almost done. You're so close. Okay.
Even just today, today we've had 2 moms who tested negative, but the partners tested positive. For a lot of people, it's the biggest moment in their life, and they want to be there, but we can't do it in an unsafe way. So, the partners test positive, they have to leave, and we try to get someone else in here who we have to then test and start the process over again.
Patients that have been positive, we tested 177 patients, and we had 32 that were positive for a positive rate of 18%. We tested 151 partners with 17 positives for a rate of 11.25%.
Well, I have no idea how I'm going to explain it.
No, your husband, I understand, tested positive.
Yesterday when I found out he was tested positive again, I think I cried for the rest of the night. They gave me the iPad, so we had him on FaceTime. My mom did come so that I wasn't alone, but it wasn't so much that I didn't want to be by myself. I just wanted that moment of when she was born to have him with me and to experience it together. It's our first baby, and going through FaceTime wasn't exactly the same, but
It's all good. It's all good. The umbilical cord, you just leave it dry. Okay. It'll fall off within 2 weeks.
Okay.
Most of the moms are very receptive. They understand that all these precautions that we're exercising are due to the need for the baby to be healthy and to mom to remain as healthy as possible.
Hi, Mikey. How did I do this yesterday?
Yeah, well, yesterday when I found out that I was still positive, besides being surprised, I was really upset. I think Shannon and I both cried. I don't think it really took away from the moment. I still cried when I saw my daughter, and I understand. That's all. I understand the precautions. I understand the hospital, why they're doing what they're doing. So
right now, he would be in here. My parents would probably be in here. Friends or his parents. Anybody, like the way it always was when a baby was born. Yeah, my mom actually said on the phone, she said, what did she say? It was like the saddest.
It's like, this is so sad. Her sister quickly corrected her and said, it's not sad.
It's the happiest.
It's the happiest day.
O sea, aquí en mi cuarto, 2 meses que no hemos salido para nada y por eso que era una sorpresa. A veces cuando íbamos al doctor, yo me quedaba en el carro y ella iba a la doctora y nunca me bajaba yo del carro. Ella se bajaba y no, 2 meses aquí, las 24 horas, los 7 días y no sé por qué.
Pero ustedes iban a veces al supermercado o unas farmacias, lugares así que todavía están abiertos?
Sí, sí.
6, 7,
Good,
8,
good,
9, 10, and again. Go, hard.
More contraction.
Okay.
Breathe, breathe.
So soft. I am.
Just breathe. It's a lot of pressure.
Very nice.
There you go, Mama. It's by the crib.
Can we have 2 2-0s, please? Good job. Mommy. Well, how's Daddy feel? Daddy? Oh my God. That's great.
Hace unas horas estábamos contentos preparando la ropa para la bebé. No nos esperamos esto y tuve que recibir sola a mi bebé. Hola, cosita. Hola, mejor de mi vida.
There are a lot of positive things that we've taken away from this experience, despite the terrible, terrible downsides. The positives are going to stay with us. And this is really the dawn of telemedicine, and this is one of the ways that telemedicine is really going to improve relationships between patients and their families and doctors.
Yeah, that's Daddy, right? That's your Daddy.
The entire world that's going through this, which makes it a unique experience. You know, and when you stop to think about that and ground yourself in reality, you still feel bad, but
We are lucky.
we're lucky. Yeah, look at this. Beautiful. It's ridiculous. It's amazing.
It does feel like you're in a special kind of club.
Ya, mija, ya, tranquila, ya. Tranquilita, mami, tranquilita. Tranquilita, mami. Ya, sí, tranquilita.
Rapid response, F3. Rapid response, F3. Rapid response.
As soon as he fell down today, so it must have been about 30 minutes ago. So we gave him some oxygen, IV. When we got him into the ambulance coming this way, he lost consciousness, started breathing. He had Kussmaul's respirations. He became unresponsive. He deteriorated in front of me in the ambulance.
Wow. They paralyzed and sedate, so they put the patient in a coma. And now the breathing machine is taking over their breathing, so they can then oxygenate, give the patient what the patient needs.
Yeah. No history of stroke, no history
of stroke. No, that's what I thought initially what it was, but I was on the line. I'm not sure it was a stroke or not. The family told us that he was diagnosed with COVID on Wednesday.
You guys can get in my ER. Come on. So we're in the back side of the hospital now? Yeah. This is, again, just one area. We have reverse isolation rooms behind you, which are rooms specifically for people who have infectious disease. But there are many more people with infectious disease than there are rooms. How's it going? How you doing? How you holding up? So, look at the volume of ambulances in here. Fire department, volunteer ambulance, you have the FEMA ambulance, you have one of our home ambulances. There are ambulances as far as this road can go.
Right now we have 77 patients in the ED. Right? So this is nothing compared to the 100 that we had on average last week. But still, I told you we had 50 beds. So we're beyond our capacity.
He's intubated, that's the only place I have.
If MCI is now basically being used as COVID or recovery or other things, what happens if there's a mass casualty?
Yeah, so it would be a problem right now. If there was an MCI right now, it would break the system.
You know, there's really no rhyme or reason to who's getting very sick with COVID and who is not.
So what's going on? What brings you in today?
My biggest fear is that since it's so new, we don't really know the effects on the fetus, you know, and the effects on myself being technically considered immune compromised as a pregnant PA sitting in the emergency room, surrounded by COVID all day.
Who's she yelling about?
This is what I've been doing for almost 14 years. You know, so at the time that we need people is not the time to step back and not be a leader. I'm due June 25th. I'm working until I deliver, so.
As a PA, you're used to probably seeing people die.
But is it just the sheer quantity that's so different, and just the sheer amount of people really suffering?
It is. Yes, 100%. It is it's a sheer quantity. It's the sheer fact that these people are not always sick people. And it's also, emotionally that, they're here dying by themselves, and their family doesn't come and get to say goodbye. I think that's the hardest part of COVID, is that people are dying alone, which is one of the hardest things.
I was talking to 21's daughter.
Okay. And what were you saying?
So essentially, her quality of life at baseline is pretty poor. She has had a stroke in the past. She's bedbound. She answers with 1 or 2 words. She really has very poor quality of life. And at this point, she's actively dying. And the next step would be to put her on a ventilator, put a central line in her, and start giving her pressors. A lot of the people that we see here have come from nursing homes. Their quality of life at baseline sometimes is diminished, and to start putting them through invasive procedures and on ventilators, especially when supply is low, when the likelihood of them ever coming off of the ventilator is slim to none, I just feel that it's not the right thing for the patients to start doing that to them. Sometimes we have to remember as providers, sometimes not doing things is also a treatment. Making them comfortable, using morphine, using pain medications, and not exposing them or subjecting them to all the things that we possibly can do just because we can do it, even if we know that the outcome's probably going to be no different.
So now we're heading to E1, one of our makeshift critical care units.
So our typical ICU maximum ever, usually 24 patients. Right now, we have a total of approximately 85 patients, all of whom are in critical care, and most of whom are on respirators. Our numbers won't come down immediately. We think it's a win when they don't go up.
His blood pressure is going up to 200s and then down to 80s. Oh, he's blinking his eye.
The patients who are all critically ill, and they're here days or weeks. I think our longest is on the other side to March 26th. So let's do the math, 3 weeks. We keep them sedated so long that sedation builds up in their system. And even if we stop the sedation, the effect could last. There are moments where, someone develops cardiac arrest. A team comes and we try to resuscitate them. Hopefully it'll be a positive resuscitation. Unfortunately, it is a daily occurrence.
There's no magic bullet. There are patients who ask us, well, I've seen this drug, I want that drug, I heard about this drug. There are no absolute medications that are available that we know that are in any way curative for this disease process.
This patient here has been with us since March 22nd. He's a hospital employee. He actually worked on one of our medical units as a patient care technician. I've been here 26 years. I can't remember not seeing him, so I can imagine that he's been here for a very long time. All my patients that he took care of took a liking to him.
Personally, I would never have expected to have to work this hard ever in my whole life, and to deal with as much pain and suffering of patients, and worse, having to tell loved ones that one of their family members passed away. And certainly that's taken a toll on all of us who have this burden to carry.
So here's an example of somebody who's weaning from a respirator. We have some expectation that he'll be able to do well if we take the tube out. We have him in a sitting position so he can maximize his diaphragmatic pull so that he can open his lungs.
It's pretty rough, but there is a glimmer of hope.
Always a glimmer of hope. Our expectation is that we get everyone off of mechanical ventilation. The reality is that some won't.
It was life or death. And praise the God of South Nassau Hospital. I was born here, my girls were born here. And telling that I was just feeling weak and that I was feeling, out of breath and I couldn't breathe. And I felt like a, not a bungee cord, but like what do you call it, a padding on my back. That's what it felt like on my lungs. It felt like a straps pushing against it. It was weird.
Well, so she was in the hospital 2 days first, and then ICU for 7?
You don't remember much of it?
No, sir.
So one of the benefits of the medicines that we give you, called propofol, is that it has an amnestic effect. So typically people don't remember a lot about their critical illness, which is good in a way.
I don't know how I got it. I don't know where it came from. But, so I'm a germophobic and now I'm worse.
The whole, I guess, challenge with this situation is not taking care of sick patients. It's the volume of sick patients that we're taking care of.
It's a complete COVID positive unit.
Is
So
there
you would
any
normally have
similarity?
patients that are walking around. This is the orthopedic unit, so they would have hip surgeries, and you would normally on a typical day see physical therapy walking up and down the units with the patients.
And now it's converted into 30 ICU beds, 15 on this side, 15 on the other side.
I'm very worried about the emotional state of the nursing staff and all the staff in the hospital, seeing so much sickness and, quite honestly, so much death, so much more death than we're ever used to experiencing in maybe even in a lifetime in the amount of a month. And it's very concerning.
Carmen, you okay? You need help with anything? What I'm doing, I am donning, putting on my isolation gown, my gloves, and Katie's going to go get my goggles. And we are getting ready to wrap a body, unfortunately. We had a loss, so we're going to prepare the body to go down to the morgue.
The staff in the beginning were so scared, I have to say. All of us were scared. If you weren't scared, something was wrong with you. And I totally appreciate the fear. And I told staff that it's okay to be afraid. We should all be afraid because it'll keep us safe. But that, that's really hard to talk to the staff and say, I know you're afraid. We're doing everything we can to keep you safe.
As you see, I filled out the tags from the patient's ID to make sure that we have the right patient.
Taking this home with you every day is extraordinarily emotional, and they're exhausted physically and emotionally. People are really struggling with the amount of death that they're seeing.
Can you pass the 10cc syringe, please? Thank you. Normally we'll have a death every, I want to say, few weeks or a month or so, and I would say, we're wrapping quite a few bodies a day. Yeah. We've also allowed the staff to have a support group that the hospital now offers that they can call to even just talk about it because it's been extremely hard. Yeah, someone's been discharged. It's all right.
Do you feel like you're hearing that a little more often?
Yes, absolutely. Absolutely.
How does that feel?
That feels amazing. It does. It just makes all the late nights and the countless hours and the stress, and when you want to just go and cry, it's all for something. Someone's getting to go home to their family.
Our surgeons have been anxious to get started. They have a waiting list of patients backlogged in their areas, and I know Rajiv has been trying to coordinate the urgent level that we've begun to accommodate, but the elective is certainly an important part of us financially and redeveloping the facility and getting it back on a sound financial footing.
Bookings are already open, so I'm sure within a week we'll start to see electives come off the schedule. So
how long will it take to get through that whole backlog before you're back to normal, do you think, in the area?
Well, we estimated we had deferred almost 1,200 cases, I think, and we estimate if we do on average 40 to 50 a day, we'd probably want to get that up to 50 to 60.
Yeah.
So you figure we can accommodate 10 to 20 additional cases a day. On a good day, without even COVID, elective, medical, whatever it is, the hospitals barely break even. Most hospitals don't generate a large profit, even in the best of days. So You put COVID into the mix, you take elective surgery out of the mix, and financially it's a disaster for almost every hospital. No one should think for a moment that COVID is a positive for hospitals financially. Not a chance.
Couldn't stop coughing, and it progressively got worse to the point where I came to the hospital. Then we found out how bad a shape I was in. From there, she knows, because once I got here, I didn't remember anything. Last thing I remember is getting out of the car here, when we pulled in here, and that's it. After that, the month of April was gone. She knows what happened. They know what happened. I was intubated and on the ventilator, what, 10 days first?
11 days.
11. My breathing's getting better. I had 3 chest tubes. They took 2 of them, 4 chest tubes. They had 3 of them out. I have 1 little one left yet.
He's improved significantly. I'm very happy about that.
What's the first thing you're going to do when you get out of here?
Probably cry. Probably cry.
There's going to be a lot of tears.
Yeah.
It's better than standing in the hallway.
Sure.
Yes, for sure.
So here I'm telling the patient on the phone that you have a big mass, which could be cancer, but it's not life-threatening to you today. So I cannot operate on you. You know, I have to wait till everything settles down.
It's very small, actually. It was a lot bigger before my biopsy. A little bit bigger than a golf ball. Right now, it's probably like a little ping pong ball now. Trust me, if you would have saw it, you would have been a little alarmed too. It looks like a whole other head was ready to go.
The concern is it could be cancer, is that right?
Yes.
That's the concern?
Once they actually remove the lymph node and like test it out and everything, they'll know for sure.
Can I just see your armband really quick? Can you tell me your name and date of birth?
Roderick Middleton.
If you go back 4 weeks ago, we just didn't have the capacity. So nobody was even looking for policies. We just literally couldn't do anything. We had no space, no staff, nothing. So 4 weeks ago, we were in such a dire state that there was no issue of looking for a policy, what can we do? When the numbers go down, that's when we met and looked at the policies. And it's only recently, about a week or so, 10 days ago, when we started doing tier 2 patients. Even for COVID negative patients, we take a lot of precautions. So these things would not have been there. So their whole policies and procedures have changed because of COVID. If they tell me, oh, it's just a cyst, infected cyst, he's great. We just go home and we celebrate. And if they say it's a cancer, looks like coming from tonsil, then I'm going to increase the incision, take out the other nodes, then go into the mouth and take out the tonsil.
I don't see anything that looks malignant here.
Thank you. Appreciate it. Thank you. Right. Good. So this is what we thought. It looks like an infected branchial cyst, which is not cancer.
They simply didn't call the ambulance. They didn't call for help because they felt that going to the hospital was equivalent to a death sentence in their mind. And so rather than submit themselves to that, they figure I can manage this at home. Many times these symptoms are recurrent. So, oh, last time I had this, it went away. So this will go away too. You never know which time that symptom is going to be evidence of a more significant progression of that disease state. It's very concerning that people are delaying care and that we are in this space that we're in now where COVID is significantly reduced in its presence in the community, in the hospital. It's still there. But people aren't coming back to get the care that they need. We have to be very cautious here. We're going to end up having this whole group of people that are hurt and never had COVID, and they're going to be hurt by COVID.